Hi, my name is Rachel and I will be performing an exam of the musculoskeletal system. So first I would start the exam by washing my hands and introducing myself to the patient. Hi, my name is Rachel and I will be the student performing your exam today. Can you tell me your name?
I'm Anna.
Anna, nice to meet you, Anna. And so what I'm going to have you do first, Anna, is walk that way towards the wall and then back. So what I'm doing, Anna, is I'm just assessing your gait, and I notice there's no kyphosis, no lordosis, and no visible scoliosis, which is an abnormal curvature of the spine. And so, of course, I would assess it further later on in this exam. So what I'm going to do now, Anna, is for purposes of this exam, I am going to assess your cervical spine. And so first I'm going to just palpate your cervical spine and then your lumbar thoracic spine. Any pain or tenderness?
No.
Okay. So what I'm going to do now, and I don't notice any areas of herniation, any bulging, nodules, anything like that. So what I'm going to do now, Anna, is just have you turn sideways. And I'm going to assess just rotation of the neck and the cervical spine, and so, or rather range of motion of the neck and cervical spine. And so what that will look like is first with flexion and extension of the neck. So for flexion, you'll do chin to chest, and extension, you'll bring your head all the way back. And then lateral rotation, you are going to not rotate your head left and right. And then for lateral bending, I am going to have you put ear to shoulder on either side. Good. Any pain or tenderness there? Okay, awesome. So we have full range of motion of the neck, and everything appears to be normal. So now we're going to assess our lumbar thoracic spine, which I've already inspected and palpated. So now what I'm going to have you do, Anna, is assess your range of motion with flexion and extension first. And so I'm going to have you bend down and touch your toes. And I am just going to trace your spine as you do that. Okay. And I don't notice any scoliosis and odd curvature of the spine. And the spine appears to be completely midline. So that's within normal limits. So now, Anna, what I'm going to have you do is hyperextend. And so I'm going to have you lean back. Any pain or tenderness? Okay, and now I'm going to do first lateral bending, and so you're going to bend right to left, yeah? And then I'm going to have you do lateral rotation of the hips, so you're going to turn at the hips, left and right. Good. Any pain or tenderness with any of that, Anna? Okay, awesome. So it appears that we have a normal spinal exam. I notice full range of motion and no abnormalities noted. So what I'm going to do now, Anna, is I'm going to have you lay down on the couch for me. All right, so first off, we're going to start with inspection and palpation of the calves and of the ankles. Any pain or tenderness, Anna? Okay, I don't notice any areas of bogginess, no nodules, no tender points. And so now, Anna, what I'm going to do is assess range of motion of your hips. And so again, we're going to start with first flexion and extension. And so what that's going to look like is I am going to have you flex your knee up to your chest. Yep. And then straighten it out, and the other side. And then now against resistance. Good. Good. Any pain or tenderness there? And so now for extension, I'm going to have you bring your leg out and then down. Any pain or tenderness there? Okay, and then now against resistance, out and down. Good. All right, now the other side. Okay, so again, have you bring your leg out and down. Okay, and then with resistance, out and down. Good. Any pain or tenderness with that? Okay, so what we're going to do now is abduction and adduction of the hip. And so what that's going to look like is for abduction, you're going to bring your leg out. And then for adduction, you're going to bring your leg over. Yep? And so now I'm going to test with resistance. And so bring your leg out. Good. Bring your leg over. Good. Now the other side. So out and then over. resistance. Good. And then resistance the other way. Good. Any pain or tenderness there, Anna? Okay, so what we're going to do next is just assess internal and external rotation of the hip. And so what that means is I'm going to have you bring your leg up to a 90-degree angle. Yep, just like that. And then rotate your leg out laterally and then medially, internally and externally. Good. And then straighten it out. Same with the other leg, internally and externally. Good. Any pain or tenderness there? So now what I'm going to do is perform what's called a McMurray's test, and that is assessing for any lateral or medial meniscus tears. So what that's going to look like, Anna, is I am going to have you bring your leg up like you did before, and then I'm just going to push on your knee and bring your leg in. Okay, any pain or tenderness there? Push on your knee, bring your leg in. Pain or tenderness there? Okay, awesome. So no meniscus tears, anything like that. So what we're going to do now is what's called a Faber's test. And that is going to be to assess for any hip or sacral abnormalities. And so for that, what I'm going to do, Anna, is have you bring your ankle up. Yep, just like that. And I'm going to put my hand on your opposite hip and just push down. Any pain or tenderness there? Okay, now the other side. Okay, pain or tenderness there? Okay, awesome. And I didn't feel any shifting, or any abnormalities there. So what I'm going to do now is assess for a lumbar hernia. And so I'm going to have you bring your leg all the way up and back down, and the other leg up and back down. Any pain or tenderness with that? Okay, great. And so she didn't have any pain or tenderness with any of those exams, so no lumbar herniation would be noted. So what we're going to do now, Anna, is I'm going to move on to your knees. So I'm going to have you sit up for me. And so we've already inspected the calves. I'm just going to feel your knees. Okay. So what I'm going to have you do first is flexion and extension. So flexion, the way you are right now, and then extension where you bring your leg out and back. And then I'm going to do it with resistance. So bring your leg out and then back. Okay. Bring your leg out and then back. Good. And so any pain or tenderness with any of that, Anna? Okay, great. And then what I am going to do next is just assess for an ACL or PCL tear. And so I'm going to assess for that by doing what's called a drawer test. And so I'm going to put my thumbs in between your tibia and I'm going to pull out for an ACL assessment and in for a PCL assessment, and I don't feel any shifting of the tibia whatsoever. And then out again and in, and no shifting of the tibia there either whatsoever. So we don't have an ACL or PCL tear. So what I'm going to do now is move on to your ankles. And so I'm going to have you flex and extend your foot. And so, yep, flex and extend. Good. And then I'm going to just assess inversion and eversion. And then I'm going to have you abduct and adduct your ankle. And so out and in. Good. Just like that. Any pain or tenderness there? Okay. And then I'm going to have you push down on my hand like a gas pedal. Yep. And then push up. And then push towards me. Or let me push. Yep. And then out. Good. Any pain or tenderness there? Okay, great. So same with the other leg. Flex and extend. Good. And then I'm going to invert and evert. And then we're going to abduct and adduct. Yep. And then I'm going to have you push down like a gas pedal. And then back up. And then push with resistance here. Push towards. Yep. And then the other way. Okay. Any pain or tenderness whatsoever? Okay, awesome. So now what we're going to do is move on to our upper extremity assessment. And so what we'll do first is I'm going to assess your shoulders. And I'm just going to first look at your shoulders. And I notice your clavicle bone there. Clavicle bone on this other side. And then in the back here, I'm gonna have you turn towards the camera for purposes of this exam, Anna. Yep. And then, so I do feel the trapezius muscles, the scapula coming down on either side, and that's equal bilaterally. Okay, any pain or tenderness as I'm palpating, Anna? Okay, great. So what I'm going to do is just assess your shoulder muscle strength by just having you shrug your shoulders and push up. Good. Okay, so we have equal muscle strength bilaterally, and so I don't notice any abnormalities there. So what I'm going to do now, Anna, is just assess the shoulder range of motion. So what I'm going to do for that, Anna, is I'm going to first have you flex and extend your shoulders. And so for flexion, what I'm going to have you do, so what I'm going to have you do is bring your shoulder straight forward and then up, and then great, and then you can drop it down, and your other shoulder straight forward, arm up, good. And then for extension, I'm going to have you put your whole arm behind you, good, and then your other arm behind you. Any pain or tenderness with that? Okay, and now we're going to do the abduction and adduction. So for abduction, what we're going to do is I'm going to have you extend your arm to your side and then bring it up to your head. Okay, and then for adduction, any pain or tenderness with that, Anna? Okay, you can drop your arms down. And then for adduction, I'm going to have you bring your arm across your body. Yep, and then the other arm. Any pain or tenderness with that? Okay, then I'm going to do internal and external rotation and assess for that. And so internal, you're going to bring your arm behind you, put it behind your back. Yep. Any pain or tenderness with that? And then for external, I'm going to have you put your arm to your side like this and then just rotate up and down. Any pain or tenderness with that? Okay, good. So now what we're going to do is move on to the elbows. And so to assess for the elbows, we're going to do internal and external rotation with them, or flexion with them as well. And so what that's going to look like is you're going to go down, straighten your arms out, and then go up, kind of like you're pumping iron. Great, and then I'm going to do it with resistance. So push up, good, then push down, good. Any pain or tenderness there? Okay, awesome. So what we're going to do next is I'm going to assess pronation and supination abilities of your elbows. And so for pronation, you're going to put your hands out like this, and then for supination, like you're holding a cup of soup. Any pain or tenderness with that? Great. And I'm just going to assess your elbow joints, and I'm just going to actually look at them, Anna. Okay. I don't see any erythema or edema. I don't feel any nodules or any areas of crepitus. Okay, I'm going to look on this other one, Anna. Okay, no erythema or edema or nodules on this side, and no areas of crepitus there. So what I'm going to do now is just look at your wrists, Anna. And so for that, I'm going to just look and any pain or tenderness when I push on your wrists. Okay, great. So we're going to test range of motion with your wrists as well. So we're going to do flexion and extension of your wrists. So we're going to do, flexion, extension. Good. Any pain or tenderness with that? And then I'm going to do it against resistance, your flexion. Good. And extension. Good. And then what I'm going to do is have you rotate and assess radial and ulnar movement. And so you're going to do ulnar, which is out, and radial, which is in. Good. Any pain or tenderness with that? Okay, great. So now what I am going to do is just look at your fingers and assess those. Okay. I don't notice any swollen joints, any nodules that would be swollen joints that might be suspicious for osteoarthritis, or any abnormalities. The skin is evenly distributed throughout. And so what I'm going to do is just test the muscle strength actually in your fingers as well. And so first I'm going to assess your metacarpal pharyngeal movement. And so I'm going to have you do what's called just a tabletop. You just hold your hands like this. Yep, perfect. So we have good flexion there. Any pain or tenderness with that, Anna? Okay, you can relax your arms now. And so I'm going to assess flexion and extension of your fingers. So flexion and extension. Yep, back and forth. Any pain or tenderness there? Okay, then with resistance, I'm going to do flexion. Yep, extension out. Any pain or tenderness with that? Okay, then we're going to abduct and adduct the fingers. So basically just pushing them apart. Any pain or tenderness with that? Okay, great. So what I'm going to do now is do what's called, I'm going to assess for I'm going to assess for any carpal tunnel. And so first off, I'm going to just assess the medial nerve, which is called a Tinel's test, and just assess and see any pain that's over. And then on this other side, any pain. Okay. Then what I'm going to have you do is what's called a Fallon's test, where you're going to hold your hands like this. Do you feel any numbness or tingling at all in the fingers? Okay, great. So we don't have anything that would be suspicious for carpal tunnel. One other thing that would be important to do in the shoulder exam before we wrap up the exam would be to do a drop test, drop arm test, just to assess for any rotator cuff injuries. And so for that, Anna, we don't want to finish the exam without doing that. And so what I'm going to have you do is raise your arm up to your side and then just let it drop back down. Any pain or tenderness there? And then the other side. And then come back down. Pain or tenderness there? Okay. So that will conclude our musculoskeletal exam. Anna, thank you so much for letting me assess you tonight. And that wraps up our exam.